some of the important pillars of health, of public health, is not just availability or accessibility or affordability of care, it's the quality of care. And what quality of care can healthcare workers provide if they themselves are uncared for, if they themselves don't receive the necessary empathy from the health system? It was important for me at this point in time to be able to be intentional about supporting other people to be able to do the work that I've been doing.
And I'm just really grateful that all of you can trust me in the ways that you do.
My name is Dr. Tlaleng Mofokeng, and those who know me very well just call me Dr. T. And I'm currently the Executive Director for OurEquity, which is a non-profit company that has started doing work in South Africa around the advancement of global health equity. It is a non-profit company, and I basically aim to institutionalize all the work that I've been doing as a medical doctor, as a feminist, as an activist, as an abortion provider, and of course as someone who's working in the global space in global health. And one of the main important things for us is to advance global health equity.
You find women in some hospitals lying 2, 3 to one bed, and these women are in labor. One may be the fluid is already coming out, the other one is bleeding, but they have to share a bed. And we don't even talk about privacy, we don't talk about cross-infection again. But no, it's as if everything is fine in South Africa. How do we justify this?
Those women need help, and there's very few help available.
It may even be that the leadership in women's health is mostly in the hands of men, and therefore the empathy is not there.
There are elements within global health that I still find that, whether they're historic or present, finding expression, that still hold us back. And so it's important to support the democratization of global health, the decolonization of global health, to be deliberately anti-racist, and also then come up with visions and programming that is truly intersectional in how we deal with human rights and the right to health in general.
The wider, more concerning challenge is that as government, we have not made sure that the people we employ feel they've got a responsibility of providing the service to women. So women continue in South Africa to be treated as second-class citizens.
And I know even as a young medical doctor, I used to be so frustrated, right, that the clinic is ready, all of us are eager to assist, and yet the patients were not coming into the facility. And one day it dawned on me that our definition of healthcare worker is limited to nurses and doctors, and yet the system is supported by the security guards at the gate, by the cleaners, by other allied health professionals. Because before I can see my patient, they get firstly either told to go away by the security guard, or they get welcomed in, but they must still see a clerk who may or may not give them accurate information about the services that are available. Then they must still see perhaps a nursing assistant who may not know where the abortion clinic lies in the hospital or the facility itself, because we are often even alienated from the actual structure of the healthcare system, from the clinics, even from our own colleagues. So I realized that before I can give the dignified care, and I may very well do great with that in the consultation room, but before that could happen, my patients had to cross so many loops and so many humps, and some make it, some persevere, some don't.
So fortunately, I'm currently in a hospital that I was born in, and it's my hometown. So it upsets me that my siblings, my cousins, my friends don't have access to things that I see as human rights, healthcare as a human right. So that drives me to be the change that I want to see in my hospital. Unfortunately, the people who are working where I'm working now have been there for a long time. So you get a sense of complacency and tiredness, because you do get tired of wanting to see change, but it's not tangible.
A thing like this weekend, I mean, that's fantastic.
I see ourselves as the defenders of human rights. And it was important and symbolic for us to be here. And it was about a 3-day retreat, which is a bit longer than we are, normally used to. And that was also important because, people were traveling from far. They needed to just relax and then, show up into the space. Everything was very intentional. And it was a retreat, and I hope people felt like they could breathe,
Ngiyayithanda it's my first time retreat beginning now, because this one I feel like it beginning nuts no chila no cabanga futhi ube space sokuthi ucabange ukuthi okay, who are you?
This is one of the few retreats I've ever heard of. I didn't even know what we were going to do. I thought maybe we were going to discuss academic content and so forth. So coming here and just relaxing is actually something that I didn't realize I needed.
Women's rights, not just human rights, but women's rights as well, are very important because they get overstepped so easily. And I feel like that's also something that I do not like personally. And I feel like a lot of women go through that on a daily, and it should change. That's why basically I'm here.
Many managers within hospitals do not appreciate the emotional and psychological investment that abortion providers actually make, far beyond what the salary compensates them for.
And I know for a fact that abortion is human rights, abortion is healthcare, and according to me, abortion is love. And it didn't make sense to me that before I could affirm those people and give them dignified care, that they had to endure all of that they had to endure before they see me. So it's important to have everyone in the chain of service, even the procurement manager, even the clinic managers, even the pharmacists who have to include our medicines that we need for abortion on their order lists, right? Even the legislators who need to keep protecting and affirming our rights need to be in these spaces, because it's about the chain of care and everyone involved in that, according to me, is an important player in this issue, because often the stigma and discrimination means that there are women that I never ever get to see or even give on the table these options for them to take.
You want to be able to empower people, to nourish people, and to make sure that they are okay, so that they can give of themselves the very best. So you are actually short-circuiting yourself as a company, as a health system, if you don't look after your healthcare providers, particularly ones that work in spaces like we do. Women's health, termination of pregnancy, where there is a lot of stigma, where there is a lot of negative connotation to the kind of work that we do.
I would love to hear from someone telling me that we are doing a good job. I know we tell each other every day, me, Mina, Elna, that we are doing it, we are helping. But sometimes it feels like it's not enough. When you are sitting with a patient, you are counseling a patient, and she says, but how do you go to sleep after you kill? How do you sleep? How do you live with yourself after all these babies that you've killed?
Seeing them connect their own experiences to the work that they do was really just so incredible. I'm getting goosebumps as I'm telling you this.
For instance, on the phone, the other lady said to me, you know what, I made a mistake and I'm pregnant. And I'm saying to her, are you seeking an abortion? She said, that word doesn't exist in my vocabulary. So what do you want? Is it an ongoing pregnancy? Are you seeking an antenatal? How can I help you, ma'am? I'm thinking of ending this pregnancy. Oh, okay. So you are seeking termination of pregnancy. Please don't say that. So to others, they can't even mention the word, but they are doing it.
After all, we are human. We feel. We've also got our own issues back from home, and we hardly ever stop to say, what do I need? What do I need? What does my family need? And that's because also there is such a pressure in terms of the overload of work, on the short staffness. So we are constantly like, you can't leave until you've seen the very last patient.
And how to take care of yourself is something that we don't really look at, because you're like, okay, but my patient this, my patient that. So this really helped me to basically find a way to relax and find myself in the space of whatever that's happening.
We also then coupled that with professional development, where they did get the latest, continued professional development material to browse and read through. But this was intentionally for them. It's not what they could do for their patients, it's how they could be the best version of themselves. And by that, the patients will benefit.
Two things for me popped out, and it was through specifically the session we had yesterday, where we really looked inside ourselves. We also kind of walk around as very defensive people with walls up because we need to get a job done, and we never stop to say, what are the cracks in my space? Like, what do I need to work on just as a human being? That stood out. The second thing that really was for me, it was also settling in a way, was to realize that we all have a need and a craving to be loved, to be affirmed, to be supported, to be given a break, to be encouraged, and it's not just always about the patient when we do our work, it is about us as well.
Because we need to debrief. We need to be out of our usual or our day-to-day spaces. We need to meet different people and know about them.
Oh, when I get invited to come here, I was like, wow, let's just go and then detox, discharge, and take all that we've been consuming from the patient, and then just have fun.
Just connect to your heart. So, talking about coming from love earlier.
Because we're so caught up in making things better for others when we don't make things better for ourselves. So these spaces are very necessary, because we have a lot of doctors who die from depression. I mean, we had the great Professor Mayosi who committed suicide, So it's those important spaces that allow you to switch off. Because when you get home, you don't really switch off. There'll be a neighbor who gets to ask you, if I have this problem, where do I go? There's someone in your DMs asking you, my urine is burning. When you get to work, the security guard is like, oh, do you know my sister has this and that, So you never get to switch off the doctor role. Because even when I'm sitting with my boyfriend, he'll be like, I have a headache. Drink water.
I think it was important for people to be affirmed as humans, as people first. And part of the content of the retreat was to have the facilitators, right, who take us through that personal journey of affirmation, but also realizing how we can live a life of purpose at a higher vibration. And it's my hope that that will find expression in the consultation rooms, not only the type of care we give to people, but also in how we take care of ourselves as we are doing that work. So we have the tools now to be able to debrief, to be able to ground ourselves, to be able to feel, right? Because often as healthcare providers, it's almost like there's this wall we have to build, but to protect ourselves. And our patients see that as a lack of empathy. So the tools to say, how am I present for my patients in the way that doesn't completely deplete me? It was really important for me to let them know that they are important, that the work that they do is valued. And for some of them in their whole careers, they've never had that conversation to say, you are valued. During the meditation, we all had the same thing to that, say we need to carry on this work. And OurEquity, to be the secretariat for this network of abortion providers, which would look beyond our borders in South Africa, look in the sub-Saharan Africa, and definitely in the rest of other developing worlds.
I think the retreat is very necessary because it's like a space where I was able to like meet people that I didn't know, but seen on like articles, like almost like Instagram and all these type of things. And to think that these people have the same thoughts as me, that in itself was just like, wow.
Some of us started our relationships on Twitter. Some of us started our relationships on emailing lists.
First of all, I must commend Dr. T together with OurEquity team, because it's very, it's foresight to be able to include the multi-generational. I know, for example, Dr. Mareka, she's 76. Prof. Mhlanga is also, he taught me at medical school.
Yeah, and he taught me third year gynecology and completely inspired my journey in life.
These are people who have passed on the skill to us, and we are more in the middle generation.
Professor Elna McIntosh, who I used to read about in the paper and say, oh my gosh, this is the type of doctor I want to be one day, that can talk about sex and sexuality in a non-stigmatized manner.
The greatest joy that many of those who are retired have is to see the skills, the young coming up and taking, that activism and the energy that they bring in.
I think everybody that was here, it is such a moment of, I think it's a historical moment, because like I said, we get to pass on the skill down the generations. And it's not just the skill from a physical perspective, but it's also the mindset. Pro-choice can be a very lonely space, so to speak.
So it was so important to in a very non-directive and non-prescriptive manner, just allow people to bond, to share the load, but also, when you're vulnerable, you often feel alone. But this was intended for us to be there for each other, that you don't have to look far and you are held, or automatically you look in the faces of the people in the room and you feel like, yes man, I met her, and I can I can be vulnerable. And there were lots of tears, and there were joyful tears, and there were also tears of, oh my gosh, we've been doing this and we matter, and we've come this far. And there were also just tears of the potential of what this means for all of us. It was I think tears of, I'm not alone. As much as we are implementers of programs and conveners, right, in this case, we also have experts, right, who are legal experts, who can do policy reviews and legislative reforms. We have amazing researchers. We have amazing communications and media people who can conceptualize strategies from scratch, all the way up to implementation. And of course, you have people like me, right, who can overlook all of those different arms of OurEquity and do different consultancies. And I'm currently, through OurEquity, in the process of actually assisting other global foundations live this feminist future now, and really, express this democratization of global health, mainly in their programs. Some of them are still very scared, right, to interrogate the structures of their organizations, but that's who we are. We are disruptors, and we are people who are literally here to shake the tables And we are not apologetic about that, because the future we deserved isn't this one that we live in. And we know the generation and the people coming behind us, they too deserve better, but we are committed to doing this work right now.
I'm so glad. I'm so blessed to have been part of this group of people to just take time to say, what do I need?
And this weekend, people did get some, information around, of course, self-love and self-care, but they did get medical information as well, practical information about updated protocols. The WHO recently published, self-care principles in SRHR, and of course the self-managed abortion, which is an important theme in the global space, and how we interpreted that in locally, and then of course making sure that we can then implement to the best of our abilities with what we have, and often it's next to nothing.
I was trying to think back when I got here yesterday, when last I was in this kind of space where I have like-minded people, and we are able to share best practices, share challenges, lessons learned during implementation of whatever program that we're doing as far as sexual and reproductive health is concerned, and how we can continue with the work, continue advocating to make sure that women's lives are saved. So it's an important space for us to have all these discussions.
Have to address accessibility, because without accessibility, you don't have equity. So we need to increase access by addressing socioeconomic factors. We need to make sure that women are employed, they have a salary, because without a salary, it's difficult for you to acquire healthcare. We need to make sure that they're informed. There's no way that you'd use contraceptives if you don't know what contraceptives are, what options are available, and where to get these contraceptives.
So our equity is that homegrown South African institution that will house and mentor, but also do programs, as well as, again, being active in the global health space, bringing across these very important elements of decolonization, democratization, anti-racism work, and definitely being committed to intersectional frameworks.
I'm hoping that our equity will be able to go stronger.
Yes, ma'am.
And the network to grow much further. And so it's all up to us, all of us here, to make sure that that happens. And that's the only way that we can reach gender equality and make sure that SRHR is actually a focus in this government. Yeah, so Talen, you're really doing a great work, and we appreciate whatever you do. We honestly behind you, and we appreciate all the work that you do. Yeah.
Yes, please. Yes, please.
We should play a part in making sure that women in our care are safe.
Yes.
And whatever is out there that needs to be fought, we have to fight.